Hello, everyone, and welcome to my session. My name is Quisha Umimba, and today I'm going to talk about community health workers, the real front line. Now, I am going to ask that you bear with me. The weather change has not been kind to me or my voice, so please show me a little grace as we try to get through this presentation today. A little bit about me. I am a registered nurse with a public health background. I am the CEO of Umimba Health, which is a public health education and consulting agency renowned for our education and training services. We are headquartered in Dallas, Texas, but Umimba Health is a virtual organization with subcontractors and affiliate instructors located throughout the United States. I also currently serve as the training director of Umimba Health Academy, which is a virtual campus for community health workers, community health worker instructors, and other frontline public health professionals. Our mission at UHA is really to elevate the multidimensional skill set, something I say quite a bit about CHWs, and we do that through competency-based instruction. Our aim at Umimba Health is to improve public health and population health practices. And so we do work with healthcare systems and public health organizations to educate their frontline workforce, to empower their leaders, and to expand their community presence. And we do all of this hopefully so that they can continue to elevate the lives of the individuals and communities that they serve. In my talk today, I'm going to share with you how my four and a half year experience as a CHW supervisor led me to become really the fierce ally and advocate of CHWs that I am today. I'm going to be providing you with an overview of the community health worker profession and hopefully demonstrating why this growing workforce is indeed a force to be reckoned with. And then hopefully I demonstrate the impact and contributions made by CHWs and how this impact really does help to advance health equity. So I'm going to start off with sharing my story with you. In 2015, I relocated from Little Rock, Arkansas, which is home, and started working as the chief nurse in the Office of Chronic Disease Prevention and Management at the Houston Health Department. And so one of the very first things I was tasked to do, even on day one, my supervisor said, oh, by the way, we need you to hire 2 CHWs for the diabetes program. At the time, I had never even heard of that term before, as community health workers were not a popular profession in Arkansas. So I really had my work cut out for me. I set out on a mission to find out about this profession that I really knew nothing about. So, what is a CHW? What do they do? How do I train them? How much do I pay them? What kind of support do they need? What kind of resources do they need? I mean, I spent several weeks really doing my research, and then I put together a job description. I think it was after a couple of rounds of interviews, we ended up hiring 2 bilingual CHWs. And then over the time of my 4.5 years there, we actually ended up adding an additional 2 CHWs there as well. So before I tell you more about my CHWs and the impact and how they supported our diabetes program, let me tell you a little bit more about our center, because I think it will provide a better perspective on this impact. So the Diabetes Awareness and Wellness Network, or the DAWN Center, I refer to it as a one-stop shop for all things diabetes education and support. I had everything and everybody but the provider, but the physician. And so my staff included a public health nurse, a registered dietitian, a fitness trainer, a medical assistant, a community liaison, a provider relations specialist, and then my 2 newly hired CHWs. And the CHWs that I hired were primarily responsible for delivering our diabetes education. I think at the time we had about 7 evidence-based DSME curriculums. And they primarily also provided outreach. So they go out into the community, enroll people into the program, and then they also come back and teach the classes 2 or 3 times a week. And our program, even though I like to think it was, extremely unique and very robust, it's probably very similar to what a lot of you all are doing in your programs now. We offered, we had a gym, we had nutrition and fitness classes, and yes, that is me working out with members of the walking club in the top right image. We provided a lot of community outreach events. We took our mobile unit out. We called it our Education on Wheels, and that's what you see at the bottom right corner there, with 2 of my staff working in our kind of buffet style Meals on Wheels, Education on Wheels mobile unit. We had a community garden, so that's me. You see at the bottom, kind of mid left, where we were having our members, is what we called our participants, gardening, and whatever they grew, they harvest at no cost to them. I mean, we had so many wonderful programs, of course, as many health departments do. And we had several chronic disease education programs as well. So diabetes, hypertension, stress management, smoking cessation, I think that covers it all. So all of my staff, those that are licensed, the RN, the RD, the fitness trainer, the medical assistant, as well as those that were unlicensed, my CHWs, provided diabetes education. They would take a cohort, whether it be 6 weeks, 8 weeks, or 12 weeks, depending on the curriculum that we used, and they would teach the entire cohort over a span of those weeks. But this is what I noticed over what I like to refer to as a 4-year observational study. Program participants in the cohorts that were taught by my 2 CHWs had better outcomes in every single category. Let me say that again. Program participants in the cohorts taught by my 2 CHWs, and eventually the other 2, for a total of 4, had better outcomes in every single category. I'm talking about waist circumference, blood pressure, body mass index, fasting blood sugar and A1C, decrease in consumption of sugary sugary sweetened beverages. In fact, the only 2 metrics that had an increase was increase in physical activity and increase in customer satisfaction. Now, when I first noticed this trend, after about 2 cohorts in, I just kind of, thought it was a fluke. But then it kept happening over and over, again and again and again. And I saw this trend for the next 4 years. And it took maybe, 3 or 4 cohorts in before I realized that the common denominator in my most successful cohorts were my community health workers. In case you didn't know, a community health worker, defined by the American Public Health Association, is someone that is a trusted member of the community that they serve. They usually have a unique understanding of the experience, language, and culture of the people that they serve. They have a deep knowledge of the resources and the relationships and the needs of that community. And that trusting relationship enables the CHW to serve as a liaison, as a link, as an intermediary between health and social services and the community. And so when I say community health workers, I'm talking about volunteers who work informally to improve the community's health and not necessarily being paid. But I'm also talking about paid individuals as well, because regardless of compensation, CHWs are on the front line. They are the frontline health and social service workers, and often the first contact that a community member will have with the health or social service agency. Additionally, CHW is an umbrella term, so it's important for you to understand that a lot of work that CHWs do, or a lot of times the title is determined by the community that they serve, or the population that they serve, or the duties that they do. So, you may see a patient care coordinator that falls under the umbrella of a CHW, or a resource navigator that still falls under the umbrella of a community health worker. So if most people were like me, when I did find out what a community health worker is and does, I said, oh, I've been doing that. A lot of times when people do learn about them, they realize they've been doing the work before they even know that the term existed. So I like to refer to CHWs as social determinant of health experts. And I think we all can agree that one of the biggest issues that our healthcare industry faces today is inadequate healthcare that fails to address the social determinants of health. I'm talking about those conditions in our environments where people are born, live, work, learn, play, worship, and age. And we know that they affect a wide range of health-related outcomes. We also know if we don't address the social issues that hinder care, then we will never address the root causes that contribute to health disparities. So CHWs are social determinant of health experts, and for a number of reasons. Now, first, because they identify with the community that they serve, there's already this established like-know trust factor that helps in their interactions with patients. And this leads to increases in individual capacity and self-sufficiency and patient empowerment. There's also been numerous evidence and studies that conclude how CHW interventions improve health-related outcomes, especially in groups that experience racial health disparities, especially when you're doing things like chronic disease management. And I've witnessed this firsthand with all of the chronic disease programs that we had while I was at the health department. Lastly, I'll say that CHWs are social determinative health experts because they are, again, they focus on the root cause of issues that are preventing patients from being healthier and from being active participants in their healthcare. Now, I'd like to share a story with you about one of our current students. Her name is Mary, and she is an LPN. And she says that if you've ever worked in clinics and hospitals, then you know that, the goal is to get them in and get them out. And so, going through the CHW course has really changed her perspective and changed how she takes care of her patients. So I'd like to share with you a story that Mary has given me permission to share with you today. So Mary shared with us a story about her client that lost her daughter in 2020 due to COVID and was living out of her car. She shared with us how she spent time working with the client to get her a bed in a homeless shelter. But on the first night of the client's stay, someone attempted to assault her client. So she ended up leaving the shelter and had just been kind of couch surfing and sleeping in her car and staying with friends, but nothing really consistent. And Mary says she knew she had to do more. She immediately sprang into action once she found out. She picked up the phone and just started randomly calling people and calling shelters and programs and anybody that could help her get her client a safe place to stay. And she said the more that she called and the more that she kept talking to people, the more doors kept opening. And she said that she would tell everyone that she spoke to, I'm a nurse, but I'm enrolled in the CHW course and I'm learning how to be better at helping people. And that immediately would open up people to providing more assistance and more information to her. And I just love every time I read that she shares that. So Mary said that one of the agencies gave her a website link to give to the client, and so she could apply for housing. But Mary, again, knowing the client was homeless, didn't have internet, didn't have a computer, she scheduled her an appointment to come into the clinic one morning, and they completed the application online themselves. She said she followed up. She made sure to convey the urgency in which housing was needed, but she was told it could be a year before housing would be available for her client. Lo and behold, it only took a month. And so her client ended up with the housing voucher and will be moving into her own apartment very soon. And Mary said now that she has been trained as a CHW and she knows about the social determinants of health and how they really impede healthcare, she's better able to listen to her patients and to advocate for her patients. There are some medical issues and health concerns going on with her patient that they just could not really address until these things were taken care of. And she said now that this is out of the way, she's actually participating in some of that follow-up care. In addition, she's also now helping her to enroll in programs that will provide assistance to help her get her utilities turned on, so her lights, gas, water, things like that. This is the impact of community health workers. This is the CHW difference. Now, if patients are lucky, they'll spend about 15 minutes with a provider. During that time, usually what happens is the doctor tells them, very vague advice. And shout out to all the doctors, not picking on you, but it's usually something like you need to lose weight and exercise, right? You need to go on a diet. And then usually the nurse, and beating up on myself as a nurse, we usually will hand them, give them a handout on the foods that they can eat and the foods that they can avoid. And that's about it in most clinics. But if there's a CHW there on that healthcare team, the CHW will spend time providing basic nutrition education. The CHW will make referrals to community resources like cooking programs like we had at our diabetes program. The CHW will give the patient a handout of farmers market locations in their area. The CHW will let the patient know if they're eligible for SNAP benefits, also called food stamps, and then help them to apply as needed. CHWs have the time to spend with addressing these real life issues that are often the real barriers and hinderers to care. Now, numerous studies have shown, over decades worth of studies have shown that CHWs help improve patient outcomes and reduce costs. And I think, personally, this has never been more evident than in the past 3 years since the onset of the COVID-19 pandemic. And I'm not going to bore you with a lot of stats, but just Google the impact of community health workers, and you will see consistent data showing how CHW interventions and contributions substantially contribute to care team productivity and outcomes, and show significant reduction in things like emergency department visits and urgent care visits and hospitalizations and so on and so forth. I say all this to say, I know that CHWs are not the solution. Don't get me wrong. I know they're not the solution, but they are a solution. And in many cases, utilizing CHWs in the clinical setting can lead to improved health outcomes if CHWs are utilized appropriately. I also want to say I'm a nurse. I know all too well how important it is to provide patient-centered care that addresses the whole person. And so we have to take care of the symptoms that they walked in for, but also so much more beyond that too. And so I've said this before, I'll continue to say it. There are enough professionals that are taking care of a patient's medical needs. There are not nearly enough professionals taking care of a patient's social needs. When I say that CHWs are the real front line, please don't think it's meant to be derogatory to clinical professionals. Trust me, I know that we work tirelessly to help patients get and stay healthy. But patients are struggling. People are struggling with real life issues, lost wages and jobs, difficulty paying for medication, food insecurity, addiction, housing, all of these things which are detrimental to their health, and certainly priorities. Health is not even a question if I don't know where my next meal is going to be, or if I don't know how I'm going to pay my rent. And community health workers have the time, again, if utilized appropriately, to spend with patients addressing these real life issues, thus preventing health-related disparities and helping to advance health equity. Now, I think that is my time for this session. I thank you so much for your time and attention. If you're an individual that's interested in being trained as a community health worker, please visit the website or shoot me an email. I'd love to provide you with more information. If you are a public health organization or a healthcare system that would like to connect and see how we can help you with your CHW interventions, please again visit the website or shoot me an email directly. I'd like to thank the coordinators of the People's Public Health Conference. It has been a pleasure and an honor to speak at your first conference, and I wish you much success on continued endeavors. Thanks so much, everybody. Have a great rest of your day and enjoy the rest of the conference.